morning. My name is Jacoby McPherson, and welcome to the National Day to Prevent Teen Pregnancy press conference. This morning we'll be hearing from our community leaders and my peers regarding the latest teen pregnancy data, the Me Now Baby Later campaign, and the National Day quiz.
Good morning. Good morning. I was so impressed to come in here and see so many young people involved in this project. Being greeted at the front door and up at the sign-in table and those walking around. I think probably Lanier is very well represented. I know several that I've met were from Lanier. But that is wonderful because that's one of the individuals or one of the groups that we're trying to get the message to about the decisions that they make in relation to teen pregnancy and the prevention of teen pregnancy. That's very important, and they can spread that word to their peers. It's also important for our community to reflect on what the issue is, what the problems are. For our community, the costs are tremendous. When you look at about a $75 million cost to taxpayers in relation to everything from health care to programs to school problems, then you look at that quality of life. Where I come from in the district attorney and looking at crime and all of the bad things that happen from child abuse to child neglect, and then those who go on to commit crime, it is very evident that a high rate of teen pregnancy relates into that. And as a consequence, our quality of life is not what it should be. So I applaud all of those who are out there today bringing awareness to the issue and discussion to the issue. And thank you for having me this morning.
Hi, my name is Brianna Campos. Why should you care about teen pregnancy? There are higher risks for mom, such as dropout, welfare, and single parenthood. For baby, low birth weight, infant mortality, incarceration, abuse, and teen parenthood. For dad, less education, low income, and distant relationships. So, it's healthier for mom, baby, and family to wait. In 2008, there were 3,854 teen births in Bexar County alone. In 2013, 175 kindergarten classes will be filled with children of teen parents. Teen pregnancy costs our community a minimum of $75 million for Bexar County and $1 billion for Texas. Teen pregnancy is not just a teen issue, but an economic issue for our community.
The teen birth rate for females ages 15 to 17 increased slightly from 2007 to 2008, but had an overall decline of 33% from 1994. However, the 2008 birth rate was 81% higher than the national birth rate for this age group. For Bexar County, it is projected that the 2009 birth rate for this age will drop to 36.4 births per 1,000. In 2008, the inner city zip codes continue to have very high teen birth rates. 3 zip codes had birth rates over 4 times the national rate. Zip code 78210 had 80 school-age births in 2008.
When it comes to sexually transmitted diseases, or STDs, reported cases of chlamydia continue to increase among young people. In 2008, we had 3,027 cases. We have seen a steady increase since 2002. Cases of gonorrhea were the highest in 2008 at 791 cases, the highest since 2006. Reported cases of syphilis jumped to 45 cases in 2008, the highest since 2006. For HIV, there were 13 reported cases among teens in 2008. This and more information is included in the teen fact sheet in your folders. Now, please welcome Dr. Janet Realini from Healthy Futures of Texas and Martinez from Project Work.
have the pleasant duty of framing this around the positive, that this is a winnable battle. In public health, the Centers for Disease Control of the U.S., the CDC, has about 8 to 10 things in public health that they deem winnable battles. And teen pregnancy prevention is one of those things. It's because we know things that work. We know what works. We just need to do it. And this is my short list to help you understand a little bit about what I've learned about what works. First, to use effective programs, things that are demonstrated to actually make a difference in young people's behavior, not just to give them the information, but to help them process that and use it and make it part of their plans and their actions. Second, access to contraception. While some of the education programs help young people wait to have sex, others can help them use contraception if they are sexually active. Some do both. But without access to contraception, 9 out of every 10 sexually active couples is going to experience a pregnancy within a year. And that's a very important part of the complex of teen pregnancy prevention. So we can help more kids wait, and we can help more protect themselves. Number 3, very important, is the positive youth development programs that are so important to give young people a positive view of their future, to understand how important they are for the future of San Antonio, for their families, for their future children, and to give them real tools to make those good things happen. Number 4 is a healthy social norm. What do I mean by that? I mean that teens get the message, that families get the message, the whole community is getting the message that while we love and respect parents who start young, it's really better timing to have your children when you've got your education, when you have a committed relationship, when you are ready to give that child everything you want to give it and be the kind of parent that you want to be. So to help build that norm, that is what is expected in San Antonio for folks on the east side, the west side, the north side, the south side. That's what we mean by building that social norm. And the me now, baby later message is part of that effort. I'd like to ask Mario Martinez, Program Manager for Project Worth, to say a few words.
In the last year, thousands of San Antonians have come together in various public forums to talk about important issues regarding education, poverty, economic development, and family well-being with the Health Collaborative, with SA 2020. And it was during these discussions among thousands of people from different walks of life who said, but we also need to address teen pregnancy. So it is important that we come together today and in the future to work together on this. It was during this time in the last year that the mayor initiated his own initiative on teen pregnancy prevention and invited several community leaders to come together to give input on teen pregnancy prevention. And this group helped to shape the mission to significantly reduce teen pregnancy in San Antonio through community partnerships and evidence-based programs. This mission is now part of SA 2020. And with his leadership, we now have a collective vision for the future, our future, their future, to have a productive and fruitful life in our community. But we need your support. We need your guidance to help them foster the message to their peers that it's about them right now. So we thank you for coming, and we hope that you can join us in our efforts in this very important issue in our community. Thank you.
As a Me Now Teen Ambassador, I believe in the Me Now, Baby Later campaign. Parenthood is wonderful, but it's about timing. There are many things we can do now. Those things include education, hanging out with friends, and helping our community. But we also need your support and guidance to help us reach our goals and dreams. One more thing. Please don't forget to take the National Day quiz at stateteam.org. Please see the information in your folder. Thank you for coming, and we look forward to your continued support.